Back now on Triad Today, and let's spend a little time talking about exercise physiology. What does that mean? We're going to find out with a special guest. On my right is Cameron Taylor. He's an exercise physiologist with Northern Cardiac and Pulmonary Rehab. That's part of the Northern Regional family in Mount Airy. We welcome you to the show.
Thank you for having me. Glad to be here.
What is an exercise physiologist? Before we get going, just help me with that.
Sure. So an exercise physiologist is someone that has usually a bachelor's degree in exercise science. Generally, I kind of like to think of it as in between a personal trainer and a physical therapist, where we know more about exercise than maybe a personal trainer does, but not to the extent that a physical therapist does. They usually do their doctoral program in that, and so it's kind of a mid-level.
Right. Now, what is pulmonary rehabilitation?
Sure. So pulmonary rehab is a medically supervised program for people with chronic lung disease. Unfortunately, there is no cure for chronic lung disease, and so this
is... my dad, before he died, he had COPD, and you just try to manage it.
Right, and that's one of the big things we try to do is help with patients with managing their symptoms, improving and increasing their strength and endurance, and improving their overall quality of life.
Yeah, I think that sometimes there's a misconception about that, and if you've lived through this with a family member, your first thought is, okay, just relax, lay down, don't do anything. But that's the opposite of what you should do, right?
Right, you should definitely try to exercise with what you can, right? Everybody's got a certain capacity with what they can do, but exercise is going to be one of the best things to try to help with that.
Now, other than folks like my dad who went through, what you're talking about with when he had COPD, are there other people with other conditions that can benefit from pulmonary rehab?
Sure, so really anyone with lung disease can benefit from pulmonary rehab. The bulk of the patients that we see over at pulmonary rehab are generally coming in with things like COPD or interstitial lung disease, but we get lots of different types of people with things like sleep apnea or cystic fibrosis or different diseases like that.
What if I come in there and I have a lung disease and illness? I mean, what can I expect to happen if I come under your program? What happens?
Sure. So it generally starts off with a referral, and that's signed off by an MD or a DO, and then that information will then come and we'll have our administrative assistants talk to their insurance providers. And once that's done, we'll set you up with an initial assessment. During that initial assessment, we'll go over your medical history, any kind of medications you may be taking, and any kind of physical maybe limitations you may have. So like, do you have shoulder pain, back pain, hip pain, knee pain, those kind of things that are going to be really important to us as we design the program for you. And then we'll do a short stress test at the end to see just kind of where you're at right now.
And this isn't just senior citizens like myself. I mean, you help younger people too, right?
Exactly. So we've had people that have come in, mid-30s and 40s to people that have been almost 100 years old. And so lung disease affects anyone and everyone.
Let me ask you a personal question since I have you here, and that's about, why you decided to go into this. I mean, was there a therapist, a doctor, a nurse, anybody in your family, or a teacher, somebody said something to you about healthcare? Why did you want to go into this kind of field?
Sure. So I went into healthcare because, as cliche as it sounds, I wanted to help people, but I think it went more into that. I wanted to be able to be with people whenever they were very vulnerable and be able to be there and be an inspiration to them. My grandfathers, both of them actually passed away from progressive forms of lung diseases, one from lung cancer and one from pulmonary fibrosis.
Right.
And so seeing them and seeing how their diseases impacted their daily life and having a hard time breathing and getting around, that made a lasting impact with me.
Well, bless your heart, I appreciate that. Let me just put up something on screen here because I want people to see this. The general website for the hospital, choosenorthern.org, of course, but for Northern Cardiac and Pulmonary Rehab, you can also call them directly for information, and correct me if I get this wrong, 336-783-8448, I believe that's right.
That's right.
And they can give you more information, and again, you get there through a referral, but call there and check it out, and they can do a lot of things for you. I really appreciate what you're doing for folks. I appreciate the fact you went into this field, and I hope you'll come back to the show sometime.
We'll do it. Thank you very much.
Thanks, Cameron. We'll be right back after this.